is Akankcha and you are here with me on Nexus Medical Media. Today we have a topic to discuss that is about congenital heart disease, and what I have picked for you, that is ventricular septal defect. Big name. Let's understand how does it looks like and then we will move further. So I'm just gonna draw a fallen cone for you. I hope it looks like a fallen cone. And I'm just gonna draw a line here. This would be your right ventricle and this will be your left ventricle. And here is a septum, right? Because these are two cavities, and in between that there is a communication which is formed by your septum. This is called as your intraventricular septum, right? Now, if I make a defect here, my wish, and this defect will be called as a septal defect, right? Then we can say that it is between ventricles. So yes, this is a ventricular septal defect. I hope you understand the definition which you read in your books. Moving on, we have some classification, guys. So what are the classification of ventricular septal? And don't worry, we're gonna talk about embryology, anatomy, and each and everything, because if you go back onto the first slide and see internal medicine, right? So we will talk about the management, clinical manifestation, and the findings, and lastly the treatment, even the surgical interventions. So please sit tight and listen to me. Moving on, we have some classification. You can see, of course, here looks like a defect. When here looks like a defect, I have a question. I'm not gonna tell, you can just write in the comment down below. What is it? Is it a right ventricle, left ventricle? I just want to hear from you. So, moving further, we have some defects looking like over here, and I have put some names for you, that is like O, T, I, and let's just change the color. So what are these defects? What is it I'm showing you? So this is your ventricular septum, which I'm showing you from the right side. Please understand this image is from the right side. Okay, and it has 4 components in it. What components I'm talking about? It has inlet septum. Okay, it also does have a trabecular septum, and as well as what else? We do also have an outlet septum. Okay, and lastly, which I have already marked for you, that is your membranous septum. These are what? Is it a classification? No, this is the part of your intraventricular septum. So let's see again. A, right? This is the image name. This is the image A. Okay, so this is the O. So obviously O would be what? It would be your outlet septum. T, this would be your trabecular septum. I, this would be your inlet septum, and the last one is your membranous septum. I hope you understood that what were the types or the structure, anything what you want to call it. Moving on, please, before that, come back here again. What is it? This is an anatomical position where I will point it out that where is the defects. Okay, please look here. The first, this is your papillary muscle. I have written for you before that. So papillary muscle of your conus, right? Then B, this is your B. Doesn't it look like a defect to you? For me it is. So what is it? It is your perimembranous defect. Okay, then moving on to the C. Again, this looks like a very big hole, a very big defect. So what it is? It is your marginal. Can you please appreciate here that this is on margin, please? So this is your marginal. And as well as I can see there is this muscle passing by. So this is your marginal muscular defect. I hope you're getting what I'm trying to comply here. Moving on. Let's go to the D, right? Again, see the line. So this is what? It is your central. Can you please appreciate it that this is somewhat in the center? So that's why I will say that this is a center. And it looks like again that this is nearby a muscle. So what will I call it? It is your central muscle defect, okay, or central muscular defect. Now let me raise a little bit so it will be easier for you to see. Please move on this side, E, right, this E. So on this E, it is your none other than your inlet defect. Okay, this is your inlet defect. Please do not get confused, hopefully. Then let's go to the last one, F, right? Again, please focus and look little bit closer. Okay, I wish I can do that as well. So here you can please appreciate here that again it's like a black hole. So this is what? This is nothing but your apical muscular defects. Okay, so this is what you had to confirm till here, and I think we are finished. Moving further, just the last thing for today, that is Eisenmenger syndrome. What do we need to know about this? Is it important for us to know? I guess a little bit. So the Eisenmenger syndrome, when we talk about it, it's nothing. It's just a combination of complex. What it will have? The first thing you need to know, obviously we are talking about ventricular septal defect. So this will be the first component. Secondly, it will also have the cyanosis. And at last, you will have the pulmonary hypertension. Okay, and combining these three, we call it as complex. Okay, but if we also have with the combination of pulmonary vascular disease and cyanosis, and in these connection, we call it as the Eisenmenger syndrome, where we will have the increased blood flow as well. Okay, I'm just going a little bit on hypothesis. Can you please tell me from where will be the shunt? Either it will be from left to right or from right to left, or there might be someone who thinks it's just from left ventricle to the left atrium. So this I'm gonna teach you in the pathophysiology. Okay, so just talking before that itself, we know that, right, increased blood flow which will be towards lungs. So please always do remember it will be from your left shunt to the right shunt. It will be the same into the arterial defect, or it will be the same for our defect which we are talking about, that is your ventricular septal defect. So thank you for today, thank you for joining my class, and we will join again.